Hello and welcome. Today we'll be discussing a serious condition affecting the urinary system, bladder perforation. We'll delve into the causes, symptoms, diagnosis, treatment, and more to provide a comprehensive understanding of this condition. Bladder perforation, or a rupture in the bladder wall, can stem from several factors. Traumatic injuries, such as those sustained in car accidents or falls, are a common cause, especially when the bladder is full. Iatrogenic causes, meaning those caused by medical procedures, include complications from cystoscopies, bladder biopsies, or catheter insertions. Other, less frequent causes include bladder cancer eroding through the bladder wall, radiation therapy, or even spontaneous rupture in rare cases, particularly in individuals with pre-existing bladder conditions. The pathophysiology of bladder perforation is relatively straightforward. When a hole forms in the bladder wall, urine leaks into the surrounding peritoneal or extraperitoneal space. This urine leakage causes inflammation and irritation. If the perforation is large, it can lead to significant urine extravasation, causing peritonitis if it leaks into the peritoneal cavity, or a localized collection of urine called a urinoma if it leaks into the extraperitoneal space. The body's response to this leakage can also trigger a systemic inflammatory response, potentially leading to sepsis in severe cases. The extent of the damage depends on the size and location of the perforation, as well as the time elapsed before diagnosis and treatment. The epidemiology of bladder perforation varies depending on the cause. Traumatic bladder rupture is relatively uncommon, occurring in a small percentage of all trauma cases. The incidence of iatrogenic perforation depends on the type and frequency of the medical procedures performed. Spontaneous bladder rupture is exceedingly rare. Specific demographic data can vary based on location and access to medical care, with trauma-related cases being more common in younger populations and iatrogenic cases seen more frequently in older adults undergoing urological procedures. The signs and symptoms of bladder perforation can vary depending on the location and severity of the rupture. Common symptoms include lower abdominal pain, a difficulty or inability to urinate, blood in the urine's hematuria, and abdominal distension. If peritonitis develops due to intraperitoneal rupture, symptoms may include fever, chills, nausea, vomiting, and a rigid abdomen. In extraperitoneal ruptures, pain may be more localized, and there may be swelling or bruising in the perineal area or thighs. Systemic symptoms like rapid heart rate and low blood pressure can indicate sepsis, a life-threatening complication. Diagnosing bladder perforation typically involves a combination of imaging and clinical evaluation. A cystogram, where contrast dye is instilled into the bladder through a catheter and X-rays are taken, is the gold standard for diagnosis. This allows visualization of any leaks in the bladder wall. CT scans with contrast can also be used to evaluate for bladder rupture and assess for associated injuries. Clinically, a high index of suspicion is important, especially in patients with a history of trauma or recent urological procedures. Laboratory tests, such as a urinalysis to detect blood and infection, and blood tests to evaluate kidney function and inflammation, can also aid in the diagnosis. While not always strictly classified into types, bladder perforations can be categorized based on their location: intraperitoneal, meaning urine leaks into the abdominal cavity, or extraperitoneal, where urine leaks into the space surrounding the bladder. Extraperitoneal perforations can further be grouped into simple or complex, depending on their size and the presence of associated injuries. Furthermore, bladder perforations are often grouped by etiology, differentiating between traumatic, iatrogenic, and spontaneous causes, which may influence treatment decisions. Treatment for bladder perforation depends on the size and location of the rupture, as well as the patient's overall condition. Small extraperitoneal perforations may be managed conservatively with bladder catheterization to allow the bladder to heal on its own. Larger or intraperitoneal perforations typically require surgical repair. This can involve open surgery or minimally invasive techniques like laparoscopy. In cases of significant infection or sepsis, antibiotics and supportive care are also necessary. The goal of treatment is to repair the bladder defect, drain any urine collections, and prevent complications. Preventing bladder perforation involves minimizing risk factors where possible. This includes careful attention to technique during urological procedures, using appropriate catheter sizes, and avoiding overinflation of the bladder during cystoscopy. In trauma situations, prompt assessment and management of pelvic injuries are crucial. Patient education about the risks and benefits of urological procedures can also play a role in prevention. The prognosis for bladder perforation is generally good with prompt diagnosis and appropriate treatment. However, delayed diagnosis or inadequate treatment can lead to complications such as peritonitis, sepsis, and kidney damage. Recent research focuses on improving minimally invasive surgical techniques for bladder repair and developing new imaging modalities for earlier detection of bladder injuries. Furthermore, studies on the effectiveness of conservative management for small extraperitoneal perforations continue to refine treatment protocols. Early intervention and personalized management strategies are key to achieving optimal outcomes.